So yes, they do tend to present at a later stage, meaning the cancer is more advanced at time of diagnosis. So even though on the whole, they're younger and aside from the cancer, healthier than some of their older counterparts, that unfortunately sort of levels the playing field for them, and they seem to actually sometimes do worse than you would expect just based on their chronologic age. So the fact that your question was two parts is perfect because I think it requires basically a two-pronged approach where clinicians, including my colleagues in primary care, my wife is a primary care pediatrician, and they have an enormous challenge to sort of discern who's really sick from the well among their sort of patients undergoing health maintenance. So those physicians have to be aware that this is a growing problem and sort of have their antenna up for that. But then I also think there's nothing more powerful than a patient who advocates for themselves. And that can be particularly difficult for a young person. Hopefully we're not too intimidating as doctors, but I still think there's this notion that somehow we are paternalistic and we're going to tell you what to do. Increasingly that paradigm is going away and we're a lot more about making decisions together. It's even called shared decision making. And so I think it's really important, especially if you only have a short period of time with your doctor for, say, an annual checkup, that you really bring to the forefront things that are concerning you. And they're hard to talk about. In my experience, young people, particularly young men, don't really want to talk about rectal bleeding. But it's important that you bring things up like obviously blood loss in the stool, but even sort of unexplained abdominal pain, changes in your weight, changes in stool caliber. These are all, unfortunately, signs that often are either suppressed by the patient or overlooked by the doctor or both. And you're absolutely right that the tendency to think that a young person must be healthy based on their age, unfortunately, that notion has been severely challenged by tragic examples like Chadwick Boseman's. And so it really calls for more attentive diagnosis. And then lastly, in answering your question, I want to draw a distinction between screening and diagnostic procedures. Screening is almost governed exclusively by age and a little bit by family history. Diagnosis, however, is when you go to your physician and say, I have XYZ complaints, and then they launch an investigation to why that's happening to you. And those are completely distinct. So coverage for screening is quite different, actually, than coverage for diagnosis. So it's really important that patients advocate for themselves and the doctor secures appropriate coverage.